Anna.
Hi, hi.
How are you?
I'm good. How are you?
Good, great. Ready?
Yeah,
All set?
yeah, we can start whenever you're ready.
Okay, great. Just give me a minute. I'll be ready to go live. Okay. Hello and welcome everyone. Today we are here again with a series Heal with Nav, and this is one more episode, yet another on depression, another mental health, which is very prevalent nowadays. As we all know, depression is a common illness worldwide, and it affects estimated 1 in 15 adults in any given year. And 1 in 6 people will experience depression at any given point in time. Globally, more than 264 million people across all is a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. More women are affected than men, and it can happen in any age, to any age group, and usually first appears during the late teens and to mid 20s. At its worst, depression can lead to suicide, and there are effective psychological and pharmacological treatments for moderate and severe depression available. So depression is a common and medical illness that negatively affects how one feels, how one thinks, and how you act. Fortunately, it is also treatable. It causes feelings of sadness, loss of interest in activities which once a person enjoyed, and it can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. There can be n number of symptoms which can lead to sadness, crying spells, or loss of interest, change in appetite, or loss of sleep and difficulty in thinking, concentrating. And these symptoms must last at least 2 weeks for it to be diagnosed as depression. And without further ado, I would like to introduce our guest today, which is Sunena Gupta. A very warm welcome, Sunena.
Hi.
Uh, yeah, thank you. She is a renowned Kathak dancer and she's a mental health advocate. Today, she is sharing her journey about how she overcame depression. She shares her journey of trial to triumph to not only destigmatize therapy, but today she is here to instill hope amongst the participants and whoever is listening and whoever may need it, that recovery is possible. It's very much possible. And, apart from recovering from her own struggle of depression, she has started her own international dance theater production by the name of Umeed, which also means hope, and which is what she represents today here. She's representing hope for all the participants, and she spreads mental health awareness and has raised about $50,000 for youth suicide prevention programs. So thank you, Sunena, for being so courageous and coming here and sharing your story, because I know it's very difficult to open up, and this is an act of courage, to come out, especially in a society where still we feel a stigma attached to mental health. So a very warm welcome and thank you.
Thank you. Thank you.
So Sunena, without further delay, let's start the interview. I would like to know from you basically, how old were you when it first started, when you first saw the symptoms?
I think I was probably around maybe 16, 17, so in high school. And it was, I noticed, I didn't know at the time because I didn't really know what depression was. And I think a lot of people around me also didn't. But that's probably when the signs started.
Mm, mm. Okay, okay. And was there any trigger for the sadness for you?
Yeah, so I was actually experiencing alopecia, which is a autoimmune condition. And so that affects your self-image because it's to do with hair loss. And so that was something that got a little more intense when I was in high school. So um, I guess the thing with depression is you don't know what the exact cause is, but I'm guessing those two were linked, which is what I've been told, and that is very common, I know, for alopecia to have mental health side effects. So I would say that, and I think in general around that age group, like you mentioned, it is difficult going through high school. There's just a lot of things going on, and planning, navigating all of that. So I think it was probably these things combined.
So it was not just one factor for you, but of course this was the life stage where you were going through a lot of changes in your schooling, and there was physiological changes as well, and then add to that this particular problem of alopecia added to it. So there were feelings of low self-esteem, right?
Mm-hmm.
Mm.
The signs that I guess looking back, I can see it at that time I wouldn't have noticed. Was like I used to be very, very active in a lot of things in school, especially sports and things. And so I started to kind of withdraw from that. And even I was a little more anxious and hesitant to even go to school. And I'd never been like that. I've always been a very enthusiastic student and very committed to everything I'm in. And so
Mhm.
those were the signs that my doctor had actually pointed out to me. And she had told me then that, these are common signs for depression and it doesn't have to be severe, but it's
Mhm.
something that you can monitor over time. And so now when I look back, then I think that, oh yeah, that was actually going on. And because it was, I didn't know about depression, so I didn't know that I was experiencing that then.
Of course, of course. So there were symptoms, but you were not aware of it, whether it is depression or not. But when did you first notice that it's not usual sadness and I need to seek professional help for this?
So I think I didn't notice, but I was really lucky that so I have a very close relationship with them. And so they had noticed that I was just simple things like I was obviously a little more moody. I would be sleeping either a lot or not at all. My eating was up and down. And so just a lot of these like everyday small things where they noticed changes in that. And so it was actually them who had noticed that, brought it up to me, and even then, I think because of the age, I was a little bit reluctant to even think about that there was something different or wrong going on. And so they had actually spoken to my school teacher, who I had a very good relationship with my music teacher, Mr. Jenkins, and so
Mhm.
they had spoken to him without me knowing, and had asked him for his advice. And so obviously, um, as a teacher, he deals with a lot of students, and so he was able to advise them to um, get me to go to the school counselor, and we had a good program in school for that. So that was kind of their planning that had got me to that point.
Okay. And was it overwhelming for you when you got to hear about this, that, oh, this is the issue and, a stigma attached to it?
Um, I think it wasn't particularly overwhelming, but it was more about, I think it's a feeling of loneliness because you don't know who else is going through it. And obviously, now on the other end, I know, and having studied it a little bit more and reading up more about it, I know how common it is. But I think at that point, it's more about, like you don't, if you're going to school every day, you don't really want it to be out in the open that you go see the school counselor every week, because that's there's definitely a stigma around that, and in high school you're not really willing to talk about it very openly, because I was still figuring out what was going on, and it wasn't specifically, I think, depression that the stigma was around, but more just the idea of like seeking extra help, or things are not really running as normal. And I think it was more about like, okay, so there's something going on, but one, I don't really know what it is. And two, I don't know how to go forward with it. Like, what am I meant to do
Of
now
course.
going forward so that I can get back to the full Sanana mode that I want to be on?
Sunana, would you be able to share some of the symptoms which actually first, were like, oh, this is happening and this is something which is not usual? So, what were some of the symptoms which were alarming for you?
So for me, like I said, the main one was withdrawal from activities,
Mm-hmm.
especially sports for me, which I had kind of always been very, very involved in. Um, and and also a reluctance to go to school. That was very unusual for me, because of just how much I liked school, and I had really good friends and things and all that as well. And then I think later on, what I noticed, one thing that for many years, and I think it still can pop up now and then, is sleep. Either what I think it's more feeling emotionally exhausted for a very prolonged period of time. And so with that, either you feel like sleeping a lot because you feel like you never really have enough rest, or it's that feeling that like I'm so tired, so worn out, but I can't sleep. And so it's yeah, I think it was like not having a regular sleeping, eating, or socializing pattern. Everything was up and down. And I think the main issue is when you're in that, you don't know that and you don't realize that. So it often takes an external um, person to kind of point those things out.
There were withdrawal symptoms, there was sleep disruption, there were eating changes in eating patterns, and there were feelings of, low self-worth, all these combined together, right? And how did your family reacted to it?
So, like I said, my parents were actually the ones who had encouraged me to go see the school counselor at that time, and I think for all of us, what I would say over like the past 5 6 years, um, it's been like a full family journey because all of us it's probably a topic that's never even come up before. I
Mhm.
definitely hadn't learned about it, and so I'm sure my parents had weren't really aware about the whole topic of mental health either. So it's kind of we were all learning together. So it's me, my parents, and my brothers also. And so I think because we're a very close knit family, that way it was helpful for me just to know that at least at home there's no stigma about
Mhm.
that there's something going on with me, and there's no like pushing that you're like. I think what I've heard from a lot of people that I've interacted with over the past few years is that the family stigma, like at home, not being able to talk about it, not being able to kind of express that, that's the thing that will hold you back the most, because then you're trapped at home. And
Mhm.
so I was very lucky that although we didn't really fully know anything about it, we were kind
You
of like
all journeyed
together.
together. Yeah. But did it scare you at any point in time that, oh my God, they are also not aware of it and how we are going to cope about it? Because since they are also learning with me and I'm not, they are not in the journey, means in the sense they are not aware of the things
Mhm.
as they should be, or probably as parents. Did it scare you at any point in time?
I think for me, probably not scared that they didn't know. I think it was more um, if there was like there obviously is fear associated with something like that, and so the fear was more about like me wondering how did this happen in the first place and
Mm.
what's the way out, because um, it's really like a feeling of darkness in that way, and but in I was always positive that there are solutions and that there are ways. Um, and I think that was also very family associated because um,
Yeah, you
like
had a support, you
yeah,
have a
because
supportive family.
yeah,
Yeah.
I'm always like fully confident that like things happen up and down and all that, but I knew that they weren't gonna just like let go and give up and
Mhm.
that, so I didn't have to worry that way. Like they took all of that burden off about like there is recovery, that's definitely possible, and so that was never a point of contention for us. It was just a matter of when.
Wonderful.
Yeah.
Wonderful. So, Sunana, tell me, was it easier for your family to convince you to see professional help because you already had hope, or was it like it required a lot of convincing on their part?
So it was actually a little funny because, like I said, my mom has spoken to my teacher in school, and so in a way, she had managed to trick me into going to see the school counselor. So she'd spoken to her, and she told me that, oh, like I spoke to this lady, and we'd already known her anyways because the school was quite a small community, and so she I think made up some reason for me to go and speak to the counselor then, and something not related to me at all. And so obviously then when I'd gone in, then we started talking about me, and I think nobody had ever labeled depression per se or any kind of specific mental health issue because and that goes back to nobody knew. But it was just, I think once I met the counselor once and was able to talk about it, then I realized like even without knowing what exactly was going on, it's just very comforting to talk to someone who's literally there just to listen and help you come up with kind of action plans of like how to get through whatever you're worried about. And especially, I think when you're in school and also in college, that's the most useful thing to have someone to and someone that doesn't know you in any other capacity, just in terms of what you are willing to share with them, and you can share your worries. And so in that way, they're able to help you. And even if it's little things about like, I have so many tests, or I have like all these assignments and things, and I'm getting really stressed out. And so it's like the really simple things that they're able to kind of dissect and break down with you. And so it kind of seems like you have a little team effort, that you're a lot less alone because you're building your support system that way.
Wonderful. So you felt supported and you felt that somebody is there with you who is actually listening to you non-judgmentally and providing you that unconditional support, right?
Yeah.
Yeah, very nice, very nice. So I would also like to know that how did this depression interfere with your day-to-day life as a student, as a daughter, uh, as a family member, and as an employee now?
Yeah. So um, as a student, I think the main thing is, so like what I was saying before, is that there's a lot of confusion and there's a lot of not knowing how much to share with your friends and also with your teachers. And so in high school, I think the main thing is that you're like, you have this thing going on in your head, and then anyways there's all the pressures that everyone goes through um, in high school and college. And so it's being able to convey to your teachers that, you know, like, I'm still very eager to learn, I'm still an enthusiastic, and I'm still a good student, but there's something else going on that I don't know about, and I'm not really at the point where I figured it out. And so it's kind of like giving yourself that space or time to, um, and I think that like leniency with assignments and things like that, those are the things that you really need, but you're kind of conditioned that you're not meant to ask for extensions all the time, or like tell your teacher that you're not able to come to class and things like that. And so definitely in high school, that was something that my mom was able to help out with, because she was able to communicate with my teachers, and it was literally just like one note that went to them that was that, you know, there's something going on that we're trying to figure out. And so um, and I was able to stay on top of my assignments but maybe not hit all the deadlines. And so having that sense of understanding with my teachers then was very important, because I knew that they didn't think that I was just being lazy, or um, you know, like just like not handing in things or not attending and things just because I didn't want to. And in so that's, I think, one of the most important lessons I learned when I went to university, because then what I was able to do, like at the beginning of every semester, is so I'd set up a short 5-10 minute meeting with all of my professors for that semester and let them know that and you don't have to share any details per se, and they'll never really ask, but you can, what I would say is that, you know, there's like, I've had some kind of like ups and downs in the past with my health, and this is how it's affected me in terms of attendance, assignments, things like that. And so I wanted to share that with you at the start, because going forward, I don't know if I might be fine the whole semester, or it might be a very rocky semester. So I want to share that with you now, so that when I'm in it, it's not that I'll be struggling and not being able to communicate with you then. And I think that is that's been the most important thing for me going through university, because it gives me a lot of relief that, okay, they know, and if there is something that comes up that's really stressing me out, if things aren't okay, I can just let them know that, like, I've spoken to you about this and this is happening, and then they're always like very supportive about it. And then on their end also, they know that like, I'm not just slacking off, or I'm not just not um, able to keep up with things just because, like, for no reason. And I think all teachers, professors, educators, because they deal with so many teenagers and children, they know how these things work. And so obviously in university, you're alone in terms of you have to communicate everything by yourself. And so learning to do that, I think by the end of my first year, was the one thing I'd say that helped me the most in terms of as a student. Um, and then the other thing is, as a friend, it's difficult. I think it there's no easy way around it, because it's a personal relationship with each friend, and it gets more difficult in friend groups, because a lot of the time, I think like making plans and things is very, very stressful, because you don't know how you'll be feeling on that particular day, and committing to a plan and then having to back out for um, like no specific reason. Yeah, like, and sometimes you can't figure out the reason yourself. It's just that I don't feel like going today, or things don't really feel right, and it's not a reflection of your friends at all, but it's more of your own thing. And so committing to a plan and then backing out, or otherwise just not being able to commit to anything. So like being stuck in that limbo is very difficult, and I think it puts a lot of pressure on you. And it's um, and I think like especially at the age between let's say between like 17 to I'm now 22, it really just depends on what kind of support system your friends are. And it's I think it's a very different relationship with each type of friend. And I think like one way that I've kind of gone around that is that it is almost like a filter for me, that like which friends do I feel comfortable with in terms of sharing any of this, or um, even more than sharing, like not pressured to share anything. Like if I can say that, oh, like, today things aren't working out, I can't make it, or things like that. Like there's no sense of like guilt or pressure that way. So I think that's one way that I found really important in terms of how I choose my close circles, and how and who I want to be around, because that's something I think, depression or not, like if you're diagnosed or not, it's something that everyone will go through with certain friend groups and things. And that's one way I think I'm able to kind of choose based on like my levels of comfort with people, like who I want to be close with, and things like that. And then as a daughter, I guess I've spoken about a little bit. It's like I think for me, I was and I am very lucky that I'm always able to share these things. But it is difficult because like especially when I go to university, I come back, and then if things aren't great, like there's a lot of excitement when everyone's together, but if you're not really feeling up to it, then there is like you're kind of stuck in that a little bit. But I think in that sense, it's maybe not from my own experience, but it's something that I've heard can either like make it or break it for a lot of people our age. I've done a few seminars, especially in India with the students, and a lot of the questions or points of concern that come up is how do you communicate to your parents, or how do you
We'll
share.
come to that also. We'll come to that. At this point, I would like to tell all our participants, if they have any questions to address to, ask Sunaina or to me, they can probably put it in the chat box, and you can address all your questions either to Heal with Nav or to me privately, or you can put it in the chat box and everyone can see. And as Sunaina mentioned here, that as a student, she actually reached out to her lecturers, to her teachers, and told them in advance, actually, I'm not okay. And could be the semester would be a good one, or it could be a rocky. So it again requires a lot of courage, to come forward and tell your teachers in advance, so that their expectations are also very, very clear in advance. And saying this phrase, actually, like, actually I'm not okay, actually keep the expectations in control. And especially for you also, a person who is struggling with some kind of mental health issue, you can probably feel at ease, because it helps in that anxiety, in that build up, that if someone is expecting a lot and I may not be able to deliver, that helps. Actually, I'm not okay. So I think as a society we need to come forward and learn that saying this phrase is okay. Telling your family, telling your friends, telling your teachers, or for that matter your employers also, that I'm not feeling up to the mark today, and I might need some space, or I might need some time to get back to things. So as Sunena was sharing right now that how she coped, I'm sure therapy would have been an important aspect of that, which helps Sunana to overcome all these things. Tell me, Sunana, how was it for you? Like from the beginning, were you this forthcoming and telling about your issues to, to the people involved? Or did therapy help you in that part as well?
Uh, no, it's definitely not until maybe a few years ago.
Okay.
Um, Something that I also never spoke about, never really needed to. And so the way I think it's important to share it with your close circle if you're feeling pressured, or if you're feeling like alone, it's difficult to handle all of this.
Mhm.
And so one way in which at least therapy helps is that you're able to like practice with your therapist almost, which is something I did like when I was 17, 18 in school. Like, okay, I want to tell a few of my friends. And so at least these 4 or 5 close friends, they know what's going on. And so I know that like when I come to school and things, they're at least there, and they know a little bit more. And so I was able to practice like, okay, this is what I want to share, and this is what um, I'm going to say. And so that I think was very useful. And again, that's something I learned in high school that I was able to then um, implement in college as well. And I think the way that I kind of got more open about it was just when I went into university, just seeing how many people around me were experiencing similar things. And I think in general, I went to university in California, and in general, I noticed that people are a lot more open.
Mhm.
Um, and I started to notice that mental health and mental illness and words like depression and anxiety and things, these are thrown around a lot in college when people are stressed, but the actual weight and meaning of it is not fully understood. And
Mhm.
and so I think seeing and noticing that was something that made me read into it a little more. And one thing that I did as kind of early on, as soon as I went to college, was find a therapist there as part of my university health services. And that was more of a precautionary step, like a just in case. And now looking back, like I'm so glad I did that then, because
Mhm.
it's one of those preventative things, right? And so I think like in terms of sharing with my college friends, because it's a whole new set of people and I was in a brand new place, is something that maybe over my first 2 years I was able to share with at least like my housemates, or I was in a dance team, so I was close to those people. And you really only need to share what you're comfortable with and with the people that you want to. There's never any pressure about, okay, I've told this person, so I have to tell this person. I think if you're confident in that, you'll just share whatever needs to be shared. Then that's like a good way to go about that. And generally, people are always going to be kind about it. Everyone roughly knows about mental health, and if I think one way that I was able to look and approach it was thinking like, okay, so now I'm sharing it with this person because I want them to be part of my support system. I want them to be on this journey with me. And I think noticing that a lot of people, when I started sharing things with them, they had like similar experiences, but I noticed that I was very, very lucky in terms of the resources I had, especially with school and with my family. And so that was the main setback amongst the people that I had spoken to in my first 2 years of university. And because of that, I started speaking up about it more, and obviously publicly in more of an advocacy sense and through my production, because it was so common, so unspoken about. And in the US, I thought it was still a little bit more spoken about, and in Singapore it wasn't, because then I noticed how common it is, and that when I was in school I thought I was so alone, but I definitely wasn't. And I think to know that it's not a question of.
Your voice is breaking.
And oh, is it coming across clear now?
Yeah, better.
Okay. Yeah, so I was saying I think it's important for people to know that it's that you're definitely not alone in it. I'm sure everyone here has someone that they know. They might not know that they're going through it, but they definitely will be someone in their circle that is. And then the other thing is that it's not a reflection of your character at all. And so, especially through my production, like being able to say that, you can still continue, overcome. And typically I think, like what my friends and family say, I'm generally, just because I've experienced depression, I'm definitely not a sad person. I'm always quite upbeat and happy and energetic, but it's, despite being that person, I'm still susceptible to depressive symptoms and things like that.
Yes. So it's not a destination, it's a journey, and you can take preventive measures. It's not that you only have reactive measures wherein something goes wrong and then we seek help from therapists, but rather we take preventive and proactive measures also. As in your case, you went and met the university therapist, right? So, and having said that, you also mentioned one more thing which I want to highlight here, that seeking therapy doesn't make you susceptible to, now it's going to be all happy and all goody things are going to happen. The goal is not here to make you flat. The goal is here how soon you bounce back from whatever happens in your life. We cannot control the circumstances, but definitely we can be very well equipped enough and empowered enough to handle all the situations which might come across in our lives. So as Sunena move on from this part, and she not only became a mental health advocate in that aspect, so she overcame her struggle, and at the same time she thought of spreading this awareness and becoming an advocate about mental health and showing removing the stigma attached to it so that people can come forward and seek therapy. So, Sunera, we understand that you have done a lot of seminars across colleges in US also and back in India also. So, in your experience, what are the most common ways in which the mental health issue shows up for college students and especially the teenagers?
So I think one, which I mentioned a little bit about, was the stress of college in general is very stressful, but in terms of assignments, exams, all of that, and there's a pressure to achieve a certain grade, perform a certain way. And in college, I think is only a part of it is academic, but a lot of it is social pressure and kind of building who you want to be. There's also that pressure involved in clubs and all these like various societies and activities and things. And so, and at the end of the day, you're doing that alone. It's not the same as when you're in school. So I think one is through purely academics. I've definitely seen and heard that and in Berkeley and in a lot of very competitive universities, it can be a very cutthroat environment. And that impacts, I think, almost everyone at some point in their college life. And then there's the whole social thing about you need to go make friends, build relationships with people, and kind of build your personality up in that way. And so some people have told me, like, purely through a social aspect, that's what's impacted them the most, in terms of either trying to fit in, not being able to fit in, not kind of finding their groove, or who they want to be around, or and because everybody is changing at the same time, there is a lot of social tension and things that can come up, and everyone's not always that understanding that way.
Mm-hmm.
And so academic, socially, and then I think there's a whole different thing about international students when they go to college, or even if you're just going to college away from home, that itself, for anyone who's like lived at home for the full 18 years and then you suddenly are thrown into a new place, that will presents its own levels of difficulty and things like that. And I think the symptoms that show up are yeah, basic things like feeling very overwhelmed, feeling
Mm-hmm.
behind in terms of school, not knowing how to manage things between academics, your social life, and other activities,
Mm-hmm.
and then not being able to sleep and eat properly. And I think just kind of feeling very confused and lost. And
Mm-hmm.
then you get a little bit more reclusive and you're not able to communicate that. And I think being in that position where there's so many things going on and you don't, it's a, I think the one word would be a lot of confusion. Yeah.
Okay. I have a question in the chat box wherein someone is asking, did you had suicidal tendencies also? Were there any suicidal thoughts?
No, so I never personally experienced that. I do have um, friends in my close circle who have. And so I was able to observe that. And obviously, as we mentioned at the start, I was fundraising a lot for youth suicide prevention organizations. So in that way, I was able to speak to a lot of survivors and family members of people who had lost people through suicide. Um, and so in that way, I was able to empathize as much as possible with that. And that really is, as you were saying, like any mental health issue and depression can lead to that. But I think that is mostly what leads to that is not being fully aware of the different options, which is exactly why I started speaking up more about it. And I think like seminars like this are great to kind of help everyone be a little bit more aware about.
Yeah.
There are so many options, and it's just a matter of like what my family always told me, like when, not if you're gonna be
Yeah.
getting
Yeah. And it's a journey. It's a journey you have to take, to be on the other side, definitely. Sunana, there is one more question because it's coming up again. So I would like to address it first before we move on to our next question, which is, didn't Sunana feel frustrated with the counselor? I did with my school counselor. They just sat there and didn't actually do anything.
Mhm.
Sunana, you have to say anything, then I'll add to it.
Yeah, so I've heard this from a lot of people who, like in university, sometimes a counselor or therapist doesn't suit you, and that is very, very common to find, because you want to find someone who you feel comfortable with, who you feel that is appropriate for what you need. And I think like one important way to kind of mitigate that as much as possible is you also have to think about what is it that you want to get out of therapy, because it's difficult for both parties if you just show up and you don't like you don't really know what you want to get out of it. So you have to think a little bit about what kind of things you want to achieve. Like, do you want it to be a session where you're purely just like speaking about past trauma? Do you want to think about like future ways to kind of get over, like there's preventative types of therapy? So there's a lot of different things. And I myself, I had like a fantastic therapist all through university, but I did also, she'd once referred me to someone else who wasn't suitable. And it's not a reflection of their profession or their training, but it's more that, okay, me and her didn't match. And so one way that my therapist had always told me, because obviously you're moving to different countries, you might need to seek a different professional. She's explained it to me in that, in a way, it's a little bit like dating, in that you have to find someone who is, um, both parties need to find someone for the other. So, but I'm sure you can speak more about that.
Becomes a match. Actually, when you go and see a counselor, as Sunena mentioned, you should have a little bit of clarity what you are looking for in the session, what you are coming for. If you can clearly state your symptoms or clearly for what you are seeking help for, it becomes easier. And secondly, sometimes counselors, for the first, especially first two sessions, the intake sessions, they are doing their assessments. So that's why they might be a little bit quieter and you might feel that they are not doing anything. Because once we go in therapies, we have a lot of expectations that this is going to magically somehow fix me in one session, which doesn't happen. And we also have to show up in totality, and the counselors, they do assessment first, the therapists, they do the assessment first before telling, or before uh, before telling you that this is the problem or this is the issue and this is how we are going to progress. Having said that, therapeutic relationship is the most important factor, most crucial factor for therapy. If you don't feel comfortable, if you don't feel safe with your therapist, if you don't feel that comfort, that rapport with your therapist, then definitely it's not a good match for you. You can go to another therapist, as Sunaina just now mentioned also, like when she went to a therapist which was referred to her by the university counselor, it didn't match because they could be a cultural thing, could be any other issue. So sometimes you just don't click, and it's not a matter of that they are not trained or there's something wrong with you. It's just that you might need some other way of handling your issues. So maybe that the way they are handling the issue is not sitting well with you. So that's the answer. I hope you got your answer. So, Sunana, again, from your experience, how can one anticipate and implement preventive measures with regard to mental health services?
Yeah, so I think what really needs to happen is more of like a full society mindset shift, which is slowly happening, and that it's mental health is something that we should think of more preventatively rather than you're in the situation and then you feel stuck.
Reactive.
Yeah, so like should be a very proactive approach, and especially like we mentioned a little bit about how it's different in college and how we're a lot more pro in this age group. I think it's something that you need to think about when you're going to college, because you're definitely going to be exposed to levels of stress, and at every stage whenever you're like I just started working, and so that's something that I also have to think about in this capacity. And so I might be feeling totally fine, very excited about work, but I also have to actively think about, okay, maybe something like this might come up, and so I have to prepare myself in terms of how am I going to share it with the people involved and people that it affects apart from me and my community, and how am I going to how can it affect them and how can I share that with them. Because if you think about these things, especially thinking about what conversations you might have to have in advance, that will take off a lot of pressure for when you maybe are in that situation, because you've already thought about it. And I think the social aspect of being able to share it with people, that is probably one of the most difficult parts, because then it's not just in your head, it's kind of out there with the other people in your life. And then I think it is and this would run across absolutely every age group and cultural differences and things, just thinking about the very basics in terms of how are you living your daily life with who are the people in your life, how do they make you feel, how is your sleep happening, and eating, exercise, those like the most basic things. I think being constantly aware about how you're approaching them and not just kind of like going with the flow, even when you're like going through a really, really great phase, it's still important to, and not in a kind of like a negative manner at all, just the way I approach it is that, you know, things are really great and I want it to continue this way. So when things are going well, like what am I doing now that I think I can keep doing, I think it's always important to recognize what you like about yourself and your lifestyle, because then you're going to keep implementing that. And when things aren't going great, then you can also look back and see, okay, I used to do this, now I'm not. Or these are the things that I believe a lot in, like in having role models. And so I kind of trying to see the people that I admire, how are they doing things, and what of small things from each of them can I kind of put into my own life. And I think over the past 2 years, especially, I've been actively doing that. Either like obviously thinking, but even writing it down, journaling, or even like just bouncing off ideas with your whoever is close to you that can be very useful. And one, so my
So
dad's
it's a
actually in.
conscious effort. It's a conscious effort. You are not leaving it to chance. You're consciously taking care of your mental health, right? Like
Yes.
if we want to take care of our physical health, we do indulge in exercise. We do take care of our diet, our sleeping, patterns. We are very very careful. It's a conscious effort. Same way, mental health is a conscious effort. And how Sunena shared just now that how she's consciously taking care of her mental health. Very nice.
And one more thing I
Yeah.
was gonna add, so my dad's in this call and he just sent me a message to remind me I had this thing maybe 2.5 years ago that I started called my Sunshine Jan. Some people call it Happy Jan thing. So at the end of every day before going to sleep, just on like a small piece of paper, I'd write the date and one thing that I liked. And so for some days it would be some like great adventure, like I went to the Golden Gate Bridge or something. Some days it would be that I went and had this really nice meal with a friend. And some days it would be simply like I was having a rough morning, but I made it to class, or that I got out of bed and then I spoke to this person, or something very, very, very small. And so then, like, that was something I started and I did for a full semester. And then when things are tough, then I'm able to like take that out and also see like, okay, I have all these small little moments, and that way before going to bed, there's always like one thing good that you think, one positive comment, one positive thing that you think of that happened in your day. That's one thing. And then the other thing I think is important that I also keep reflecting on is um, what kind of person do I want to be, and what kind of person do I want the people around me to know me as. And I remember in one of my India seminars, we spoke a little bit about this, and I think recognizing like, okay, it's important for me to be kind or hardworking, or a simple person, or resilient, and things like that. Like if you think of four things, and um, and these will change over time, then you're always kind of focusing and thinking about, okay, what am I doing now? Is it fitting into those four characteristics? And I think that's like it's basically what we're saying about a lot of self-reflection and like actively trying to engage in
Conscious
who
effort.
you are, who you want to be, because that will help you the most. Things are always going to be up and down, um, but having like clear goals and about how things that you can control it, that I think is the most effective probably.
We invite questions, more questions at this level. If you want to ask Sunena anything, you can probably send it in the chat box. And meanwhile, Sunena, how do you think, actually, how do you thought of becoming a mental health advocate? And how did you choose actually to depict your own journey of depression with Indian classical dance?
So I, as I was saying, when I kind of found out about more people experiencing mental health issues, so I have been dancing since I was 7, um, and probably more professionally in the last 4 years. And I kind of always wanted to do like bring together dance with something I thought was impactful. And so I do Kathak, which is really um, it's the art of storytelling. That's what we call it. And so a lot of the times we depict stories like from Ramayana, or like old different myths and things like that. But I wanted to, so I was questioning, why can't we tell stories from today? Like, why can't I tell my own story, like how I tell some of the other ones? And so that's something I worked on with my teacher in terms of building what my story was, and then sharing that through dance. I think there's a few reasons why I did it. One was simply because I really like dancing. I really like Kathak. And for me, myself, that was very, very important for me in terms of healing in any capacity, because it was always, um, I think when you're doing something like dance, then it's like you're thinking about only the movements and you're so fully engrossed in it that you can't really be thinking about any other issues that you have. And then, but in terms of projecting that to an audience, I think Indian classical dance does have quite a good viewership, and especially the targeted audience that I wanted to convey this message to. And Singapore is quite popular, and so that way people come to watch. Either they come. So I was doing this production Umeed about mental health, and it was a Kathak production. So people will come either to watch the Kathak or for the message and things. But either way, whatever reason it is that they come, or simply maybe just to watch someone that they know, is that when you're in that hall, there's 500 people and you're all sharing that one experience. And so the way my show went was that it was Umeed Colors of Hope. And so I showed the 6 different shades of life. It went from happiness, orange, red, anger, black, sadness, and then went to white, green, and it ended in the colorful segment. And so it's kind of in that way was showing a journey of someone going through mental health challenges, self-image challenges, chronic illness challenges. And it was in a way my own journey, but also what the way we tried to create it was something relatable to anyone who was watching in whatever, it wouldn't even have to be mental health issues, but whatever it was. And so when you're sitting there, then you're all kind of like, you're so engrossed in the performance because it's something like you're looking at, you're listening to, there's a lot of like audio visuals going on. And so you are, the way these like experiencing a dance theater production works is that you are reflecting on your own life. And especially because the production was in my own voice. So it's like I was talking through it.
Wow.
It's like I'm directly speaking to whoever's sitting there and sharing it like a conversation. And so I think some of the most like positive comments that I got after that were people who were able to kind of say that like, oh, I noticed that my child has also been going through something similar, like what you depicted in the first half. And so if they've been noticing something, but they weren't so sure, I think it's one way for them to say that, oh yeah, this person's definitely going through that, or I'm definitely going through that. And showing the full journey out to hope is very reassuring, I think, to see that there will be different shades, but you are going to come out on the colorful side. I think that encourages people to reach out to other people, either for help or to help them, because it's more like you're not reaching out and saying that, oh, I'm stuck. It's more like you're reaching out and saying that I'm in this situation and I'm trying to get to this other side, the second half of the show. And so I need to actively think about how to seek help or how to go about this. I think showing it as a journey is a lot more impactful than kind of like sometimes people don't want to read about it or attend talks and things about it, but seeing it through dance, I think can be, you get both the benefits, you get to watch a show and you're learning something more.
Definitely, we will. And I encourage all my listeners also to definitely go and see this production. When you say different shades, I just want to know, Sunena, was healing linear for you, or were there many, many shades, or was there backsliding also in this journey, or was it a linear progression?
Yeah, so I think it's definitely not going to be linear for most people. And even like while I was doing the shows, I did them for 2 years. I started off like very enthusiastic and things, but even during that, I'm sharing this message, but I had my own separate life going on with college and things. So there is always up and down. And I am very happy that like I was able to find like my therapist or doctors or whoever was part of my support system, and even like friends and family in terms of recovering. But there are setbacks, and I would say even maybe about 8-9 months ago that it was difficult, and even especially the last leg of the tour, it was very difficult because I have my own internal struggles, and then being a student and then also putting on the production can weigh down on you quite a bit. And so it is definitely not linear. It's always going to be a little bit more back, and I wouldn't say back because you still are going forward, but it more just like in a up and down trajectory. But I think that that's really important also, because then, so like the second time you go through something like that, then you're able to look back at the other lessons, and you're only going to be building up more resiliency in that aspect. So after you're through it, then like for me, I was a lot more, um, I think I was like very grateful that I had that like second setback, because it was just a reminder that this can happen 10 more times. It can happen so many more times, but I know I'm going to only get better at dealing with something like that.
Okay. Anna, we have a question here that did counseling contribute to your growth also in addition to the recovery?
I missed the first part of the question.
Okay. Did counseling contributed to your growth also in addition to the recovery part?
Yeah, definitely. So a lot of the time, what I mentioned how like you can use it to heal past trauma. So for me, especially with the alopecia aspect of mental health, in that way, I was able to use therapy to kind of go through that unresolved trauma and kind of figuring out my emotions, but then also going forward at the end of every session, we would always come up with, okay, these are the things we discussed, these are the issues, so let's come up with mini action plans and for me to try out. And so then like over the next few weeks before the next session, I was able to actively think about, okay, this is what I discussed with my therapist, this is what I'm going to try out. And I can definitely say that like now, if I hadn't been this therapist for the past 4 years, I wouldn't be speaking here, first of all, because I wouldn't have been as confident. I think it helps you to figure out who you want to be, because you're the one who's talking and sharing and getting more comfortable with your own self. And so that's always going to help you in growing into more of, you recognize more about who you want to be, especially in the age group that I'm in. Like we're really just been trying to figure out what to do with our lives. And so in that way, it doesn't have to be related. You don't have to go to therapy linked to a specific issue. It can simply just be you have someone there to help you be the best version of yourself and able to guide you. And in that aspect, I think it's definitely helped me grow more than anything.
Wonderful. Thank you, Sunena, for sharing so openly, how therapy has helped you, not just in recovering from the situation and from the struggle, but eventually in your growth also. And as Sunena was recommending, that therapy can be for anyone, probably in order to gain clarity where we are right now and where we want to go. So it gives you a perspective, not just in those terms, you also have a person who is by your side, you know, giving you that unconditional support and positive regard and that safe space which you may not have or you may not feel with any other person in any given point in time, but therapists can provide you that with that. And having said that, therapy also instills hope. The fact that Sunena is sharing with us her story today, it's a story of hope. It's as her dance production also mentions Umeed, so which is hope. So she is instilling hope in each one of us that recovery is possible. So while a therapist may be expert in the process, but the client is expert in their own lives, they know where they are, they know what they are going through, what they are heading, where they are headed, and therapists can come and journey with them as a follow person who is journeying with them and can help them in the process. So it's a journey together. It's not expert and a person who is taking the expert advice, but a journey together like a mentor or a mentee. And the relationship, it's a very beautiful relationship when matched properly, and when there is a rapport, definitely can work wonders. And depression is definitely, I don't know how many of you have seen that black dog YouTube video wherein they explain how depression can take over all over your life and how it is difficult to cope, how it is a constant struggle for a person who is going through depression. So that becomes if you can if all of you can actually see that video on YouTube that's called Black Dog video of depression, you will see the constant struggle a person goes through every day, and day in and day out. And despite of that, Sunana being here and sharing her journey, hats off to you, Sunana. Thank you so much for being here and instilling hope, because depression is not a weakness. It's not a sign of resilience. It's not something somebody can snap out of. It needs proper intervention. It needs definitely proper intervention in terms of therapy. And we have people telling you hats off to Sunana for sharing her journey with depression and also using dance to spread the message of hope. And I would still invite if anybody would like to ask any question, or to Sunana or to me. We still have few minutes, so we can take any more questions. Do we have any questions? Okay, Sunana, I think there was one question which came up earlier, which was like how a parent can convince a child, like in your case, your mom tricked you to go and see a school counselor, right? So do you have any ideas to give to our audience?
Um, I think from my experience, the biggest thing that helped was seeing my parents being comfortable with seeking help and being able to talk to me about that, because I already knew there was so much stigma, but kind of like, I mean, your parents are the only people like who you're looking up to every day. And so seeing them be very comfortable in the topic and being very certain that that there are solutions, I think from like for any parent, or like the main tip I would say is that it is very important if you're on the side where you're supporting someone who's going through something, that you can show that to them, because they might be uncertain, they might be in a very confused and dark position, but you kind of do need like a strong pillar of strength and support that you can uh, look up to. And you also, as a parent, I think it's important to show that you're not judging your child for not being able to do something, you're not pushing them. And I think those are from a child's perspective, I think those were the main things I think are important in speaking
Yeah.
to a lot of a whole variety of students. I think the one main issue that comes up is that the issue of judgment and pressure. And so you don't want to be putting that onto your child or anyone else who you're trying to help.
So build that safe space for your child, for them to come and open up to you. Don't judge them. Don't stigmatize them. Don't say some remarks which you might, in your enthusiasm, in your feeling to help them, you might actually hurt them. That's called toxic positivity. Just snap out of it. You have so many things to be thankful about. So we don't have to do that. You, as a parent, don't force or threaten them to therapy. Don't force, rather provide the safe space, listen to them, give them that feeling of connection with you. Once they are connected with you, once they feel that you are not going to judge them, they will definitely open up to you and they will definitely seek your suggestion. Do not blame but support. Do not threaten but encourage and motivate them. Do not collude with them that, oh, okay, but rather work together with them in this journey. And do not be critical and angry with them. It's not in their control. They are not acting out, they are not being dramatic, but things are really happening for them and it's difficult for them to control. So please be supportive, and at the same time, do not be overprotective with them. So you can be firm and at the same time be loving and nurturing to them. So thank you so much, Sunena, for coming today and sharing your story of hope, resilience, courage, and instilling hope in all the participants and all the viewers across Facebook, wherein we are going live. And I know many people are going to benefit from it. Thank you so much. Thank
Thank you so
you.
much.
Bye bye.
Bye.